This is Michelle Sherman, president of MishRx Pharmacist Consulting Services and the host of the Conscious Pharmacist Podcast. Welcome to this incredible kickoff to 2023 and season 3 of the Conscious Pharmacist Podcast, where we're doing this incredible collaboration with Dr. Blair Tellermeyer and the Healing Medicine Show. It's a collaboration of both shows called Metamorphosis. Welcome to the show, Blair. I can't wait for this series.
I'm so excited to be here, Michelle. And yeah, this is the opener for season 3 of the Conscious Pharmacist Podcast. So I'm really honored to be a part of this series to kind of launch the podcast for 2023. And this is also the opening episode of the Healing Medicine Show for 2023. So I'm super, super excited about what we're here to talk about, which, I think is really to attempt to take a few steps back in order to give us more perspective as to where we want the future of pharmacy, the future of medicine, and the future of healthcare to go. So thank you so much for having me.
No, oh my gosh, my pleasure. As we talk about the metamorphosis and the changing shift, not only in our lives and in pharmacy and in the world, this will be like a 4-part series. And this first episode that we're on right now is innovation and healthcare reform. Let's open that can of worms and talk about innovation and healthcare reform. And
healthcare reform, like we're already digging in deep here, right?
We'll jump right in and get that cocoon warmed up.
Yeah, I started a conversation on LinkedIn the other day about what you perceive to be kind of the number one issue in healthcare and in pharmacy. And I heard a lot of pharmacists that were saying, it's the working conditions. And there's right now, currently 2023, there's pharmacies, corporate chain pharmacies that are offering $50,000 to $100,000 sign-on bonuses. And, when we ask the pharmacists what's going on there with the corporate chains and how are you feeling, they're saying, I'm burned out. I'm being asked to do more with less resources. I don't have the staff help to safely fill the number of prescriptions in the time that I'm being given to meet quality metrics, and that you can keep your sign-on bonuses. And yet what we're seeing in the media very much shares a different narrative around the pharmacist shortage. And what I'm hearing is pharmacists are saying there is not a shortage of willing licensed, or there's not a shortage of licensed professionals. There's a shortage of licensed professionals willing to be in that sort of environment in their professional careers. And we're seeing nurses on strike. We're seeing physicians leaving primary care. We are really at this time where what I'm hearing is healthcare professionals, for the first time ever, really beginning to question the healthcare system we were born and raised into, from the perspective of, what is causing the brokenness of this system, and how do we, as healthcare professionals, stand in our truth and begin to really speak out about the changes that we are hoping to see for the future. And that's really what I call healing medicine. And it starts with an inward journey, and I've been on that inward journey personally for myself to really reconcile these two sides of my personality as a pharmacist, but also someone that is very intentional with medication use and has a much more holistic view of medicine and healing than you would think a pharmacist would have. And I know you share that as well, Michelle.
No, absolutely. And those sentiments you echo about all our colleagues out there being stretched to the limit, like overworked, this perceived shortage of pharmacists. I mean, what there is a shortage of adequate jobs for pharmacists, not a shortage of pharmacists. And, hopefully the media tags onto that activity, that's what's really going on. And when our colleagues are, like you mentioned, forced to continue to work under these dire conditions that are not safe for the pharmacist, for the health. I mean, we just read, a couple of years ago, a pharmacist, she actually died on the job behind the counter because they wouldn't let her go home. I mean, what more dire situation could you get than dying on the job? I mean, I like to compare look at our healthcare system like it's unconscious and on life support. And how do we resuscitate the system that we have that's so corporate driven, where everything is about the stockholders? Our lives as citizens, our lives as pharmacists, and people utilizing our healthcare system the way it is, are really like part of the ticker tape of Wall Street. We're just profits. Prior authorizations get denied, drugs don't get covered, drugs get denied. And it trickles down to, these, vertical integrated healthcare systems, like some of these chains where they just cut back on the pharmacists. The pharmacists are giving vaccines. They're doing everything, all the services that the company requires, while they're trying to fill hundreds of thousands of prescriptions a day. I mean, it's just completely unacceptable, completely unconscious. Each piece is disjointed. And us as pharmacists and healthcare providers are really, in my opinion, the key to pulling this all together. So how do we reform healthcare and make it conscious, take it off life support, so that literally we don't have the most catastrophic healthcare system in the world?
Yeah, we do have the number one healthcare system globally in spending. Other than that, we're not first placed in much of anything. And the life expectancy in the United States has gone down. So we now have a system that is over 70 years old, that has not been integrated with conversations around lifestyle change. And I think that is handcuffs that are being put on the healthcare professional to say, you need to treat this cardiometabolic disease, and we're creating more and more medications. And now they're not pill form, now they're injectable, and we're creating this amazing technology. And there's a time and a place for the intervention of modern medicine. And thank goodness we have those interventions. My husband has a mechanical steel heart valve. He wouldn't be here today if it wasn't for a life-saving surgery and for medicines that he takes every single day for his heart valve. And I think that we as healthcare professionals are feeling the effects of living in that disjointed system, where we're being asked to be altruistic for the sake of maintaining these corporate profits, maintaining us as, the number one spender in healthcare, with, really, if you look at health outcomes, if you look at the health of the population, we change. But last time I looked, I think we were ranked 46th most healthy country worldwide. And that's not a statistic that I'm very proud of as a license holding healthcare professional in the US. And for I think many professionals who are feeling this misalignment, but not really sure what does that actually look like in practice. There's not an incentive to change for insurance companies, for pharmaceutical companies. There's no incentive to change the system. So where is that incentive to change the system? It has to come from, really, I think, the healers that are involved in the system to say, you know what, I think that there may be a better way here. And that's the conversation that I think we're really introducing with this Metamorphosis series. So as as we're looking at what does this emergence, what does this healthcare system look like if we were to reimagine it for the first time in 70 years, reimagine the nutritional recommendations. I mean, I'm not sure that anyone's going by the food guide pyramid anymore. If we begin to have these conversations around the root of illness, and part of that is looking at our relationship with food, looking at our relationship with alcohol, looking at our relationships within our own lives. And when we become conscious of what's happening in the now, I think that helps us to get a bit of better, vision and clarity of what it is that we're creating.
No, absolutely. I think, we have to look at the great advances in medicine and in pharmaceuticals and everything, and really like balance it with like the fundamental ways and holistic and lifestyle and food and all those things, the way we did it 10,000 years ago. As human beings, our bodies are these magnificent organisms with hundreds of millions of, processes and enzymes and just magnificent things that happen every day. And I think we're a little bit, I don't know who we think we are, that we've in 2023 figured it out, that we've got the solutions, because we have this incredible Western medicine that we need, but we have the system, and we don't know all the answers. How can we? So being able to integrate all that together and look at the whole picture instead of just adding pills, never coming to the symptom of what's causing whatever's going on with the body in the first place, and trying to address those things, and that sickness, if you will, obviously has spilled over into our healthcare system. That's just a profit-driven thing. When you look at all these insurance companies that have hundreds of billions of dollars in profits, and people are dying because they can't afford their insulin, or they can't afford the medicine, the life-saving medicines that they have, is that not like a testament to the catastrophic situation that we're in? Is healthcare is a fundamental right. I always think, a healthy society is a wealthy society, and it's got absolutely nothing to do with money. So all these profit-driven systems that we have throughout the healthcare system, and pieces where everybody's trying to grab a piece of the pie, and at the end of the day, the patient is the one that suffers the most.
I remember, I don't know, this was maybe mid to late 90s, the Human Genome Project, and they were talking about when we're able to fully code the entire human genome with the Human Genome Project, then we'll be able to see the root cause of these diseases, like, Alzheimer's, and find a cure for certain types of cancers. And I mean, we're there. It's 2023. This is nearly 30 years later, and we have access to genetic sequencing. And when I look at the data, I've run genetic sequencing on myself. So I think to kind of maybe start getting into our own personal stories, I think that looking at how the genetic code affects the way we're metabolizing certain medications, I really didn't put that together. I'd learned about it in pharmacy school. We talked about the cytochrome P450 system. And it wasn't until I did a pharmacogenomics test on myself and found that I was, I had a double mutation, variation in my MTHFR677T gene, which basically means that I wasn't able to methylate properly. And, I'm also remembered back to pharmacy school, the methylation cycle and how big of an impact the methylation cycle has in cellular metabolism. And putting all of this together and sharing it with pharmacists, it began sparking these connections of really, like you said, Michelle, seeing the body as a very interconnected system, that it isn't so simple to block a sodium channel here and not see any effects elsewhere in the body. And is that the best way to, to intervene? It is an option, but also what is the proper duration of use of that medicine? Because if we look at most of the evidence, the evidence-based medicine, first-line therapy for diabetes or first-line therapy for hypertension, all of those first-line therapies say in combination with a healthy diet and lifestyle. And that's the piece that kind of, is the ... Take your diabetes medicine with a healthy diet and lifestyle. Not take your diabetes medicine and don't change anything, because we can always increase the dose if it's not working. And that's the cycle that I think we've fallen into. I work a lot with health tech startups, and everybody's into AI. So how are we using AI to input this health data to help us have better outcomes for our patients? And I just said, I don't need an AI to tell me how to get better health outcomes for our patients. I can tell you that right now. If you want to have a patient who has a better health outcome, the patient has to be invested in their own care. It cannot be a, just do as I say, not as I do kind of thing. And I think our job as healthcare professionals is to have the time to sit down, to connect with our patients, to have these relationship-based conversations that's way longer than 7 minutes. So 7 minutes is the average physician patient visit in the United States. In the state of Florida, it's actually 4 minutes. And it's ridiculous to think that anyone could achieve a better health outcome in 7 minutes per visit. It's like, those like 7-minute abs videos or whatever. It's like you might get have 7-minute abs if you do this, but if you continue eating an entire large pizza as soon as you finish your workout, you're still probably not going to get the result that's shown on the front of the box. So I think this is kind of a great time to begin to think about, what does that meaningful change look like, and what does innovation in healthcare look like? So I think that's kind of what we're talking about here on this series.
No, absolutely. I mean, and slowing down to step back instead of the speeding up of our society. Now, like you say, medical visits are 7 minutes. In Florida, they're 4 minutes. Like, what can you do in that time? And even on the patient side, it's just like, give me a pill. There's got to be a pill to fix everything. I was reading the other day, they developing pills so you don't have to exercise. Like, oh my God, like we're going to be just like vegetables on the couch, with thumbs that work to flip the remote. You never have to get up, and it's just going to make this worse. So we really have to come back to who we are as human beings, be conscious, not only ourselves, but the whole system as a whole. And, doctors, pharmacists have to be paid better to be able to see less patients, to be able to engage one-on-one with the patient and make the difference. I'm sure every time I engage with the patient and do my assessments and consultations with patients, I'm astonished at the way they're so happy, like to get someone who's actually engaging with them in the first place, talking to them and being able to answer all these questions and provide a framework of whatever's going on with them to come up with solutions, whether, it's pharmaceutically based with a lot of the patients, but also what kind of modalities can they adopt to improve their health, just even like a personal story on myself. Like several years ago, I had a herniated L4 and L5 from doing too much weights in the gym, and I went to physical therapy, and it really wasn't helping. And one Monday morning before I went to work, I was at the physical therapist, and I literally couldn't walk. I couldn't pull my pants on. I just couldn't do anything. So the orthopedic surgeon that I'd seen before was in the medical building right next door to the physical therapist. So I got myself there or whatever, and he ordered an MRI. I'm lying on the floor in the MRI office like for 2 hours before they can take me with my legs up on a chair because I couldn't even breathe. Anyway, herniated L4, L5. His solution was more Soma, more Vicodin. And if it doesn't improve in a few days, he can either shave off the disc or give me an epidural. Well,
wow.
Shaving the disc wasn't an option for me, and sticking a needle in my spine wasn't either. So it's like I have to come up with another modality. So I have a naturopath, nurse, holistic guru in San Diego that I work with, and I called him up, and we started these exercises and these different modalities, and stretching and working out and doing yoga and doing qigong and all these things. My back is perfect. I've strengthened my back and never had to go down Vicodin, Soma, or surgery. Like, why would you shave somebody's disc if you didn't have to, without trying these other modalities first? And it's never the go-to first. So this traditional way, our healthcare system, the way it is right now, is really making us sicker and never looking at the cause. There's always, I was taking Vicodin and I was taking Soma, but I was not fixing the root cause of the problem.
Of the injury.
Ever. Or you're not fixing the injury.
You're not healing the injury. You're medicating the symptoms of the injury.
Exactly. And I think with so many of our patients, it's the same thing. Just give me a pill for that. And when you think about, by the time we get sick with something, whatever it is, whether it's a back or, hypertension, diabetes, or anything, how long did we do activities that got us to that point? It's not a quick fix. It's not a pill that's going to fix it overnight. It's not going to fix it overnight. It takes time. My guy in San Diego told me, I asked, how long is it going to be till I feel better? Well, it took you like 55 years to get here. It's going to take a year or two till you feel better. So, we have to slow down.
Yeah. I remember, I think in pharmacy school, I was learning that most back injuries are a result of, years and years of repetitive motions. And there's the way that DOs and osteopathic surgeons and chiropractors have been trained for years. Those surgeons are actually commonly recommending acupuncture along with the rest of their post-surgical physical therapy and care. And I think also there's supplements, there's meditations, there's qigong, there's movement practices that don't look like going to CrossFit or, lifting weights in the gym that can still be really beneficial. And, I think that's probably what we really need to be focusing on with our patients, is helping them to avoid getting to the point to where they need the medicines, they need the surgery. If those are the final options, not the first line therapy, and having a program or an offer in place so that we have a way of dealing with that to be able to help them make those healthy changes. And again, it's not done in 7 minutes. So it's what we're here to really talk about today.
This is Michelle Sherman, president of Metamorphosis Pharmacist Consulting Services and the host of the Conscious Pharmacist Podcast. We're here today for episode 2 with our collaboration between the Conscious Pharmacist Podcast and the Healing Medicine Show with Dr. Blair Tillemeyer. And today we're going to talk about integrative medicine business models and entrepreneurship. How's it going, Blair?
It's going wonderfully. I think, part 1 of this Metamorphosis series, we kind of began to dig into our own personal stories and I shared a little bit about finding out that, that I had this methylation deficiency. And you shared a little bit about your back injury and, how you were able to heal from that without using, or using constantly the pain medicines and surgical interventions and things that you were offered as first line therapy. And so I think in part of this series, one of the things that I'd really like to have our listeners here of the Conscious Pharmacist podcast and of the Healing Medicine show to begin to think about in realizing is that if we want to have a career that's more aligned, that's more meaningful, that is more purposeful and helps us to live with passion, look at what we have been through, look at our own personal experiences, and begin to question maybe how you're approaching your own personal health. So, for me, I was trained as a pharmacist. I remember talking about the importance of folic acid in pregnancy for neural tube development, and I never dreamed that I could be one of those MTHFR mutations. I thought, it was kind of a footnote that was mentioned, that supplementation may be required for the small percentage of the population that could be affected by this genetic variant. And when I got to doing my own research, it's actually very common in Caucasian women, also in Asian women, to have this methylation enzyme, this missing MTHFR enzyme, or I would say not missing, but underperforming enzyme. And it was after the birth of my second child. He was born, and immediately the neonatologist wanted to order an ultrasound on him. And, he's minutes old, and the first thing that my healthcare professional says to me is, I need to order an ultrasound on your son. And I said, why? And she said, he has a very deep sacral dimple that could be an open neural tube. And I said, let me see it. And she said, let me get him cleaned up and, get all the gunk off. And this is, like I said, he's minutes old at this point. And she hands him back to me, and I look at it and I say, this looks just like my daughter's. And my daughter has one at the very tip of the base of her spine. There is a very deep dimple. And later I found out from my dad that was the dust dimple, that was a hereditary dimple that has been passed down. When we talk about generational curses, I'm also wondering if some of these generational curses could be linked to our genetic code, our hereditary genetic code. And maybe so, maybe not, who knows? But we know that there are things like cycles of alcoholism, cycles of mental health challenges that are passed down in families from generation to generation. And so when he said that, it really was like, whoa, this is something that's normal on that side of the family. That's unusual. I took folic acid. I took prenatal vitamins for both my pregnancies and in between my pregnancies. So there's no reason that I should be deficient in folic acid. So I did the genetic test on myself. It showed out I was at a very high risk for Alzheimer's and also for Parkinson's disease. My maternal grandmother, the dust side, has Parkinson's disease, and my paternal grandmother died of Alzheimer's disease. And I remember that kind of being the gateway drug, methylfolate and methylated B12 became the gateway drug for me to really begin looking at nutrition and supplementation in an entirely different way, and really being empowered to say, this doesn't have to be my story of having this fate of an inherited neurological disease. So So that was a big part of my paradigm shift, I guess you could say, in my own approach to my personal health.
No, absolutely. As our careers have evolved and, becoming a pharmacist, why we became pharmacists and working in a pharmacy, and then expanding into these, roles and these careers that, we've both created for ourselves. I mean, when I started Metamorphosis Pharmacist Consulting Services in 2005, everybody around me thought I was like insane. Like I'd lost my mind. Like you're going to leave this, secure behind the counter job and go and do this. But I knew from my core that there's more. And, this shift into this metamorphosis into like integrative medicine, looking at who we are as individuals and, transposing that on information with our clients is so important. I mean, how did I get onto this journey for, health and integrative medicine and everything? It was also very, very personal. My partner had all these health challenges like fatigue, called chronic fatigue, tired. She's an athlete, was a professional athlete, and just doctor after doctor after doctor. Oh, there's nothing wrong with you. It's all in your head. You're crazy. On and on and on. And it was around about 2006. She came back from the gym, and her muscles just completely seized up. She couldn't even get up the stairs. We had to call like 911, go to the hospital. Oh, magnesium's low, this and that. PCP said, oh, you just didn't drink enough Gatorade in the gym. That was the thing. Anyway, this goes on and on for years and years and years, just very tired, pushing through like a lot of stuff. Anyway, in 2013, she woke up one morning and she couldn't even get out of bed. Like literally couldn't use her hands, couldn't use her legs, couldn't actually like move. Like she's like sipping coffee like through a straw while I hold the thing. We go to him. Oh no, it's magnesium again. This is wrong. Don't know what's going on. We went to like immunologists and everything. Oh, it's just arthritis, from, all the sports you've been playing. It's arthritis. We're just going to put you on steroids. We went to like the best like orthopedic practices in LA. Like these surgeons like work on the Dodgers and the Angels. Like it's like it doesn't matter. It's the best. I'm of the mind when it comes to your health. Like what price are you going to put on that? Nothing matters. I like don't care how much it costs. Anyway, also it's a bursa, it's a this, it's a that. Anyway, in the end, we find a doctor, an integrated medicine in San Diego that's referred by this nurse naturopath that I mentioned, and we go, and it turns out she has Lyme disease. Chronic Lyme disease, all these things, headaches, everything. And I know how sensitive she is to like pharmaceuticals. If I take a dose of something, she needs like a minuscule dose of that same something. And I knew that antibiotics would kill her the way they treat Lyme, if they even recognize that it's a real thing. And we did research. I don't know if you've heard of Stephen Bonner. He recently passed away, but he's a botanist. And he created all these. He's got a whole series of books on, antivirals from plants and herbs and things. And he had a whole book on Lyme. And we researched like everything. And we, together with this integrative medicine doctor in San Diego, we put on a protocol of all these tinctures and herbs and supplements and homeopathic stuff and everything, as well as like juicing. We have an organic farm like half a mile away from our house, and I literally got fresh stuff every day and juiced for like a year. And thank God, touch wood, today she's like symptom free, like a rock star, like being able to exercise and do everything completely like turnabout without going the traditional, like putting on vancomycin and all these antibiotics. I knew it would kill her. So, obviously this isn't for everybody, but it was the route we decided to go. And we were able to shift her whole system to put the Lyme in remission, if you want to call it, or whatever. And then she's on like just a maintenance course of supplements and things like that. But that's what got us into this thing. And I did a holistic lifestyle course with Paul Chek. I don't know if you've ever heard of Paul Chek. He's from San Diego and all these kind of things, and then took me into the more spiritual, energetic kind of modalities. And I really try to incorporate that in the work that I do with patients every day. And you've created an incredible business model. innovation, creating pharmacists that are entrepreneurs who want to get out from behind that strangling assembly line, like Lucy in the chocolate factory, and do what they feel in their heart and their passion is to help patients. How do pharmacists make that shift?
Yeah, I thank you for sharing that, Michelle. And it's so good to hear that, there is healing, that our bodies are created with this intelligent design, that when we can get out of our own way, so to speak, and allow our bodies the building blocks that it needs to do the healing of its own, whether that's physical or mental or emotional or spiritual or energetic. I've heard that when you ask someone, what's the most important thing in the world to you, that you'll hear a million different answers. When you ask a sick person, what's the most important thing in the world, they only give one answer, and it's their health. And it is the one thing that, when we can begin to view that as the guide point, the North Star for our profession, is healing, that's an innovative idea. And my work has always been around advancing the profession of pharmacies. And as we're talking about these innovative business models, people are going, well, how do I get patients to pay for that? What should I do? I mean, there's a lot of diabetics that come in my pharmacy. Maybe I could help people with diabetes. And I say, are you passionate about diabetes? And they'll go, well, I mean, I'm passionate about helping people get off their diabetes medicines. And so then I go, okay, kind of kept coaching them, like, well, how would you imagine yourself doing that? And then the conversation becomes, well, I'd recommend intermittent fasting. Well, I'd recommend a ketogenic diet. Well, I would recommend, healing their gut health. I'd recommend juicing. I'd recommend the nutrigenomics test. So there's so many opportunities that the last thing I want to do is hand someone this business in a box that's not going to work for them. It's like, why would you want to train yourself to be an entrepreneur, to open your own consulting business like you have, specializing in HIV care and living well with HIV, or like some of my other clients that have specialized in helping women who are trying to conceive naturally, or to heal depression and anxiety through mindfulness, through Reiki healing, through sound frequencies. I mean, there's so many opportunities. People ask me, what's the best business model? And I'm like, well, the best business model is the one you're passionate about. It's like, you wouldn't want to sign up for an MLM company to sell something that you didn't really feel all that excited about. My best friend's she's a nurse practitioner, and I'm going to tell on her, but she was asking me about signing up to sell this makeup line. And I was like, well, how long have you been using it? And she was like, well, I just started. I just think it's a good opportunity because no one else is doing it. And I said, well, do you wear makeup a lot? And she's like, no, I never wear makeup. And I'm like, I don't think you're going to be very good at selling something that you don't use. And, just because you think it's going to be a great idea and a business model, I'm not going to discount that. It may be, but I think the variable there is what I talk about for entrepreneurs. And when I teach pharmacists to think like an entrepreneur, it's problem, solution, variable. And there may be, there's lots of problems, lots of health problems we can solve out there. So Lyme disease, for example, if a pharmacist, I know there are pharmacists out there. I believe Christine Arsenault is helping patients heal from Lyme disease holistically. So she's providing a solution for patients with Lyme disease. But then there's also a variable. You may be the best clinical pharmacist. You may have the most amazing program in the whole world that could heal all of these people. But the variable is, if no one knows who you are, if no one knows what you're selling, it's like having the greatest restaurant on earth that no one's ever been to. And that variable, I think, is important for us to really begin to think about what would we do as an entrepreneur? What would that innovative change be? And so I recommend first looking into our own personal stories, the advocacy that we're interested in and the things that we're curious about. And I remember writing my pharmacy school essay when I applied to pharmacy school. And in the essay, I talked about wanting to study novel drug development in the Amazon rainforest. And of course, that didn't happen, but it has kind of come full circle today. Now we have this retreat center in the blue zone, beach rainforest area of Costa Rica, that I'm actually bringing healthcare professionals to this blue zone, to this rainforest, and helping them to experience this lifestyle medicine that integrates meditation and yoga and plant-based nutrition, and giving them the time and the space to really look inward, to retell their own stories, to decide what is it that they would like to bring to the world in order to have a bigger impact and legacy. And that's something that I'm super excited to be able to do, because it's so important that whatever business model we build, that we feel a confidence behind it, that we know our program is going to work.
Oh, absolutely. Well, I mean, first of all, your retreat in Costa Rica sounds like totally amazing, where one can just be immersed in, the energy of the forest and really get to who you are. And, you hit on a great point. Like, you can have the best program in the world, but if no one knows who you are, what good does it do? And I think notoriously as pharmacists, we're the best kept secret in healthcare, and the worst at talking about ourselves. We go in the shadows and take care of our patients and do just extraordinary stuff every day, and nobody knows about us. And I think just now we're standing on the mountaintops with our hands held high, like screaming, like, look at us, look what we can do. And I think the COVID pandemic really brought that to the forefront, where pharmacists really stepped up, and the world, the media, and everyone around us really realized how critical we are in our role as healthcare providers.
Absolutely. So I think part 3 of our series, we're going to start digging into that, really start digging into what opportunity has the pandemic created for healthcare professionals and pharmacists to really begin thinking about what this new paradigm in healthcare could look like, and what personal shifts we need to make in our own lives to do our own healing, to do our own inner work, so that we can overcome some of the mindsets and limiting beliefs that's really keeping us stuck in this broken system.
No, absolutely. I always believe, if you dream it, you can be it. And, go for the pie in the sky. Look how big the sky in the universe is. There's plenty pie in the sky for everybody to have as much as they want. And we've got to just reach for that. And I can't wait until we, discuss part 3 and the identity shifts for success in our next episode. This is Michelle Sherman, host of the Conscious Pharmacist Podcast and president of MissionRx Pharmacist Consulting Services, bringing you the Conscious Pharmacist Podcast Metamorphosis Series in partnership with the Healing Medicine Show and Dr. Blair Tellermeyer. Welcome to episode 3, Blair, Identity Shifts for Success.
Absolutely. Thank you so much for having me, Michelle. I'm passionate about this subject because, as we were talking about in part 2 of this series, really I first started to practice what I preached in starting my own business for the very first time after I lost my job as a clinical hospital pharmacist. And this was, 2014. I was pregnant with my first child, and I'd been told that, pharmacy was a safe career. You're always going to have a job. And I ended up really in this time when I was 6 months pregnant, and I couldn't imagine going back to just a single job. So I began looking into starting my own consulting business. And, I just kind of thought of creating a side hustle in doing medication therapy management reviews for independent pharmacies here in my area. So I'm licensed in Arkansas and Missouri. And that kind of gave me the permission. I thought before I even started my LLC, I had so many limiting beliefs about myself. I believed that I couldn't run a business because I didn't have an MBA. I believed that I wasn't an entrepreneur because I didn't take any of the entrepreneurship classes in pharmacy school. And I didn't even know how to register an LLC in my state. I didn't know how to set aside taxes as a 1099 employee. I knew none of that. And yet I just felt so called to entrepreneurship and to the freedom of being self-employed that I was actually, after a few years of working in consulting, I was still working as a retail pharmacist on the side and doing my consulting. More and more pharmacists started reaching out to me saying, how are you doing this consulting? How do you set up an LLC? How did you get liability insurance for yourself? And they kept asking me these questions, and I very quickly got to the point to where I couldn't answer them all. So I took on a few one-on-one clients just to see if I could help these pharmacists to do their first MTM cases and kind of walk them through what they need for legal, logistical purposes. And even then, I had so much imposter syndrome about even calling myself a business coach or an expert in MTM that I just had to come up with this new word. I wasn't ready to let go of that identity of a pharmacist, and I wasn't ready to fully step into entrepreneurship. So I combined the two words, pharmacist and entrepreneur, to create Pharmapreneur, and that was the LLC that I began working with other pharmacists to help them set up their clinical programs. And so at the end of 2015, I had coached a few of these pharmacists to get their LLC going, to get a few clients to start doing MTMs. And I very quickly realized that I was not going to have time for another job. And so I thought, how do I do this to where I can get this information out to a lot of people at once? And I was working with a female entrepreneur mastermind group at the time, really focusing on just trying to grow my business here locally in Northeast Arkansas. And in doing that, actually the business coach said, Blair, have you ever thought about creating an online course? And then you can just allow these pharmacists access to the course, and they would get information about how to set up an LLC, how to register the business in their state, how to plan for quarterly estimated taxes. And then I did that, and I thought, well, I'll put it out there. We'll see if anyone's interested. 8 pharmacists signed up, and we went through that program. It was initially just a 6-week program, and we put another 16 pharmacists through it in March of 2016. And at the end of that cohort, some of the pharmacists came back to me and said, Blair, this is fantastic content. I've got my consulting program ready to go, but I really want to go work with physicians. I want to work in primary care. How do I collaborate with physicians in my state? And so then I really started, that's opening a whole nother can of worms when you get to looking at the huge variety of what pharmacists are allowed to do from state to state. You would think it's all the same what a pharmacist does, but that's not the case. So we have provider status in some states, but not at the federal level. And so it makes pharmacists working in a primary care setting, we have no CPT codes that we can bill for our cognitive services. But we do have codes that we can bill Medicare Part D for MTM services. So that's what I was doing. When I began looking at how does a pharmacist work in an ambulatory care setting and bill for their services, most of it had to do with collaborative practice agreements. So that's when I really began looking into it and began connecting with pharmacists that were doing super cool things. And one of the amazing pharmacists that I met, she shared with me about her program that had community pharmacists in the Skid Row area of LA that were screening homeless patients for HIV. And that person was Michelle Sherman. And, I remember you telling me that story, Michelle, and I was just absolutely blown away by the bravery and the willingness to provide such a much needed access point for a very, very medically underserved community. So I still remember that interview that I did with you, and I just wanted to really thank you for sharing that, because it was so inspiring to me, and I still think about it.
Oh, wow. I mean, talking about transformation and, working with communities that are underserved or discarded by our society, I think is so important. If we want a healthy, wealthy society, we have to take care of our society. And it's very rewarding to work with people who've really been marginalized and discarded by society as a whole, and really put a face on those individuals and acknowledge them and acknowledge that they exist and that they deserve a place in this world, in this pie in the sky that I, talked about earlier. We all have a place, no matter who you are and no matter what your bank balance is. We all have a place. And I think that's, so important. And, your story from, creating the Pharmapreneur Academy and having like a place for pharmacists to go where they can like really realize their dreams, because that self-talk that you were talking about, like how one doesn't deserve it and I can't do it, and all those thoughts that go on in our head all the day, all the negatives of how we can't and we don't deserve something, is really not who we all are. And all the pharmacists out there who are listening to the show, you can shift, you can change, nothing stays the same. Every breath we take is different. Every day, every minute of our lives, things change. There's flux. We're not the same people we were yesterday. We've got new cells. Our bodies regenerate and create new cells, new everything every day. We don't have to be stuck in that quagmire. And for myself, and shifting from an HIV pharmacist, like working in a pharmacy filling prescriptions, I just knew I had to shift and create the consulting company. And as I mentioned before, people thought I was like insane. And you have all this like, oh my God, how am I going to like make ends meet? How am I going to provide? How am I going to do this? But you just shift and you can create that. So, what you created was a novel, like innovative way for pharmacists to realize their truth and how they can shift. I know if I ever stayed like filling prescriptions behind a counter, I would have given up pharmacy long ago. I think as pharmacists, we've got to look at ourselves not so much as scientists, but as creators. And we have this canvas before us. How do we create something extraordinary for the health of our patients? And I mean, I think that's what's the most exciting thing about what I do every day is, I wake up in the middle of the night having these epiphanies like, oh my God, I can do this. And how do you help your patients with that? Be this artist, be this creator, and create and shift yourself from where you are today, maybe behind the counter in a chain store, like literally stressed out, high blood pressure to the max. And where do you take yourself? Because I think all have gifts that we can give to our patients that really change their lives. Changing the life of one patient in a day, just making a difference is like everything. Talking about, online and everything, through my HIV Thrive website, I had created a program, Living Well with HIV, 6 steps to increase vitality. And I do a lot of talks around LA and, Southern California for patients on this topic, talking about thoughts, food, water, breathing, exercise, and, all those modalities. And I still run into patients, and every time they see me, they tell me how much water they're drinking every day. So
I love that.
We mustn't disregard the impact that we as pharmacist healthcare providers have on our patients, because what we tell them really sticks with them and can make a difference, no matter what's going on with the patient. So, sometimes, and I think I'd mentioned this to you before, we can't cure somebody, but we can heal somebody. Even when you think of people dying and on hospice, just being there for them and listening to them, talking to them, maybe even providing some of the meds that they have to take in the end of life, being there for that person at the end of their life, I think is the greatest gift you can give somebody. And being able to heal them before they die. And that's happened multiple times, especially like with HIV patients who have been disowned by their families because they were gay, and then they have AIDS and being just completely marginalized and disregarded. But if you can do those things for them at the end of their life and just be there and just listen and talk to somebody, you don't have to cure somebody, but you can heal them at the end of their life journey. So those are important.
I believe that, I believe that the energy of healing, going back to the laying on of hands, like we don't even do that anymore, but the laying on of hands used to be a big part of the process of healing. And I think that there needs to be that intention there for what does healing look like in this scenario. Maybe for the person in hospice, acting as as a healthcare professional, acting kind of as a death doula to help with the anxiety and working through those stages of grief. I remember taking a very, very impactful class. I still think about it, in undergrad, called On Death and Dying. And it was taught by the same professor. I think he had been teaching it for 30 years. It was recommended for all pre-pharmacy, pre-nursing, pre-med, pre-dentistry students. And it really, really changed the way I understood Kubler-Ross's 5 stages of the grief and death and dying process. But I think a big part that stood out for me was the power of words and the healing power of words. And as community pharmacists, the opportunities we have for having very meaningful, very impactful conversations every single day are really our own responsibilities. And, I hear pharmacists say, I'm so busy trying to keep up and meet company metrics and do all the things with no staff. Now I've got this person telling me that I should be doing MTM and I should be, walking out to the OTC aisle to have a conversation about nutrition and health. Like, she must be crazy. And I don't ever want to talk about these clinical services as you should be doing this, or that's the right way. I mean, there's only one way, and it's the way that you want to practice. But when I fill in at a community pharmacy, I may say, I may only recommend over the counters 50% of the time. And that's probably on a good day. Someone comes in and asks me, what should I take out here for constipation? And I'm like, oh, you could get, some water, some dried prunes, go for a walk, like, get some movement in. Like, there's so many things that I would try before I would recommend, some type of laxative over the counter. So that change, that shift in perspective and in the way that you want to practice really comes from within, and it comes from that personal formula for success. And maybe your idea looks, of success looks different than my idea, or looks different than Michelle's idea. In fact, it should look different. It is an extremely personalized career journey. Your career is your career. And to say that the pharmacy organizations aren't doing enough, or the pharmacy schools aren't, accepting the right candidates, or, whatever. There's a million people we could blame in every single scenario. The thing that I think consciousness and having a conscious approach allows us to do is to take that step back and ask ourselves, is that the way we really want to show up in our day-to-day career? Because if you don't like the way that pharmacy is being marketed and branded, if you don't like the way things are being led by our leaders, well, there's a real opportunity for you to decide who you want to be and how you want to have a voice. I mean, on paper, I should not be a leader. I am a small town girl. I was raised in a very small town in rural Arkansas. I know that's redundant, but 6,500 people. It's a rural agricultural community. My husband and I own a farm. We just started. We're first generation farmers. We have a pasture raised egg farm where we raise 20,000 chickens on our 50 acres. And we produce for a company called Vital Farms, and they're very focused on humane, pasture-raised, quality food products, particularly eggs, pasture-raised eggs. And so we contracted with them, and we're now selling our eggs in Whole Foods and in Publix and in Kroger's and Walmart's. And so if you ever pick up a package of Vital Farm eggs, and you scan the side, if you look, Telemeyer Farms with a PH is actually our farm. And I don't have a residency. I don't have a board certification. On paper, there's nothing that stands out that you would say, oh, Blair, she should be one of the most influential pharmacists in the United States. There's nothing on paper that would make you think that. And yet 2 years in a row, I've been voted one of the most influential pharmacists. And with that, because it's voted on by peers, and my message has continued to be a more holistic focus on nutrition and on how are we approaching this whole health model in order to kind of be coaches, in a certain sense, coaching our patients to better health. And so I think, there's so many opportunities that have been created because of this transition to working digitally, that now many of the consultants that I work with offer telehealth visits, and they can specialize and they can brand themselves. There's a Hashimoto's thyroiditis pharmacist named Isabella Wentz, who is a world-renowned expert on Hashimoto's thyroiditis, and she's written books on Hashimoto's protocols. And I think because of her own personal story with that diagnosis and how she was able to make some of these lifestyle changes to help alleviate this autoimmune disease, she's just been a real champion for these patients that are dealing with, kind of a niche diagnosis, sort of like Lyme disease. And there's an opportunity in today's digital age to create an online presence for yourself and to really focus on a specific niche. And I think that, that's what I've done, and that's what you've done. And that's an opportunity that all pharmacists have, should they choose it.
Oh, absolutely. And I think it all the design of your practice is a personal journey, like you said. It's not something, oh, I read a book and this is how you do it step by step. You can give the outline, but the practice and the setting and the way you create it, it comes, from within you. So yeah. Great. Well, I'm looking so forward to part 4, talking about leadership, wellness, self-care, and personal development in our next episode. This is Michelle Sherman, president of Metamorphosis Pharmacist Consulting Services and the host of the Conscious Pharmacist Podcast. Here today with episode 4, leadership and wellness and self-care and personal development, with the Healing Medicine Show and Dr. Blair Tellermeyer. I'm so excited for this final episode of our Metamorphosis series, where we talk about leadership and wellness.
Absolutely. So this is part 4 of the series. If you're just catching this series, part 1, we talked about innovation and healthcare reform and the so-called pharmacist shortage and why many pharmacists are looking towards new opportunities. And part 2 was really about identifying some of those opportunities, especially those in integrated business models, integrative medicine, and entrepreneurship. Part 3, we talked a little bit about this idea of success and how personalizing your idea of success and overcoming some of those limiting beliefs about yourself really can allow you to become a leader. And so I'm excited in this part, in part 4 of this Metamorphosis series, is that kind of embodiment of the vision that you can create for what it is that you're transforming into. So I know, we talked a little bit about, about this importance of professional development and this kind of approach to lifelong learning. And so it started for me, my journey with learning that I was positive for the MTHFR mutation, changing some things around my diet. Well, 2020 happened and changed even more things about my life. So I got pregnant in February of 2020, and then we all know what happened in March. So I found out I was pregnant probably about 4 weeks before we left for Cairo. I was speaking at an Arab International Pharmacists Conference, and I remember the date because it was right before my birthday. It was March the 8th, and I spoke on stage. I went back upstairs to my husband. He was in our hotel room. We had left our 2 older children at home, and I was pregnant with our 3rd. And the only station not in Arabic was the BBC. So he's not normally one of those people that watch news stations 24/7, but we had it on because it was the only English speaking station. But I remember watching it, and there was a reporter standing in the middle of an abandoned street I believe she was in Venice, and she was saying everything here is on lockdown. The only organizations or companies that are open are pharmacies and supermarkets. And I thought, oh, how interesting. There's this COVID pandemic, hopefully it'll blow over in a few weeks, but they've left these pharmacies open because they're finally recognizing the importance that pharmacists play in fighting, population health issues. And we left Cairo. We went to Luxor. We did the Valley of the Kings and all that. Well, at this point, there was a few people on a Nile River cruise. We didn't go on a Nile River cruise, but there was a few people who were supposed to be staying at our hotel that had tested positive. So, I'm newly pregnant, not sure. This was around the time that the Zika virus, in 2019, you remember the Zika virus and the impact on the developing fetus, and that was the number one thing in the news. Well, at that point, I'm wondering, is this COVID thing related to the Zika virus? Is there a risk for my unborn child? Is there a risk for me? Am I going to get quarantined in Egypt and not be able to get home to my two older children. I mean, I really started worrying about this time of, am I even going to be able to get home? And at the time, no one in the States was talking about it. Our temperature was being taken almost everywhere we went in Egypt at that point. And I remember flying back to St. Louis on March the 12th, and the only person that stopped us or asked us any questions whatsoever in the airport in St. Louis was someone that offered to give us directions to our car. And so I remember driving straight home, picking our kids up from school, coming home, not sending them to school on Friday, and then school being called out on March 13th and us quarantining for the next 71 days. And the trauma of the pandemic and pregnancy and everything that we really went through on a global level, it's very unusual that every single person on earth be affected by the same thing at the same time, like has happened with the COVID pandemic. And there's been a really renewed focus on natural immunity and conversations around natural health. And I'm seeing a further divide with the COVID vaccine, of a kind of a mixed review from healthcare professionals of, are we recommending this or are we not? And how we navigate some of these ethical and moral issues, I think will take a very conscious approach to what it is we believe in and what our truth is, because I think that's only going to become more important as humanity continues to evolve and adapt and be challenged further by environmental pressures that are resulting in some of these chimeric diseases.
Oh, absolutely. I mean, the COVID pandemic was, we talk about disruptors, become a disruptor, be a disruptor. But I think the pandemic was a disruptor that disrupted the entire world.
Yes.
Stopped everybody like dead in their tracks. And, while that lockdown, everything was so catastrophic, it's like, I look at everything as yin and yang, black and white. Mm-hmm. There's two sides to every coin. What was the good that came out of that? And we did get all this disruption. For myself, like talking about telehealth, I mean, I had Zoom health long before the pandemic. I was venturing into doing telehealth consults and everything. And, we talked about it as a healthcare system for a long time. And then suddenly, from one day to the next, that was the only way of communicating with anybody, was via, like we are right now. So it was a major shift and a major catastrophe, like for everybody. I think everybody on earth had the opportunity to be with themselves and revisit like the consciousness of the world. And, we got the vaccine and, things you mentioned about the vaccine and our immune systems. And, as pharmacists and healthcare providers, with all the drugs we take and not focusing on food and our well-being, moving, exercise, water, things like that, it really comes down to our immune system. And that's personally, and in my family right here in Dana Point, we focus on our immune system. If you can focus on your immune system and maintaining the integrity of your immune system as a whole by the thoughts you have, by the food you eat, by the water you drink, by the exercise you do, by the sleep you do, how you breathe, and how you live your life, then you can have a healthier immune system, like focusing on gut health that you had even mentioned in a previous episode. All those things, if you have a healthier immune system, then all these viruses, all these invaders, if you will, that we will encounter, we will do better if our immune system is healthier. So everybody has a different immune system, and, the stress we put our bodies under, the tiger chasing us continuously in our lives, like literally people completely wigged out, depressed, frantic, complete frantic lives because we just don't stop. Every single one of those activities affects our immune system in a negative way. So until we look at the integrity of our immune system with all these things, how healthy can we be? And I think, as pharmacists and healthcare providers, we have to walk the walk, right? If we completely stressed out and we're talking to a patient about like yoga and meditation and, just let me finish my pizza while I tell you what a good diet you should have. Like, who's going to listen to you? So we have to walk the walk. So, you've got your retreat in Costa Rica, and what does that even mean? Like, for pharmacists listening to this, how do we tell somebody what is self-care and how do you grow, and what is personal development? Because I think some people think, I stand behind the counter in this chain drugstore, I've been there for 20 years and I'm going to retire or just die behind the counter. We have to learn like every day. And how do we as pharmacists take care of ourselves and our personal development so that we can be our best selves, not only for ourselves and our family, but for our patients as well?
Yeah, I think, it's no secret how to be healthier. Just eat right and exercise. Simple as that, right? But it's not that simple. And I hired coaches and trainers and people to help me to really understand how stress was playing a big part in my depression, postpartum anxiety, and dealing with that stress. I first line therapy, you put you on an antidepressant, and it doesn't work for me. And I think part of that walking the walk can start with stress. If you say, I'm a picky eater, or I don't have time to cook, or, I'm good to be able to inhale a sandwich in the pharmacy while I'm working a 10-hour shift. Like, I get it. I've been there. I've worked for Walmart. I've been in the busy chain drugstores. So I am not ignorant to the challenges and the stress levels that are inherent in that type of environment. But I also realized that I was bringing that stress home oftentimes, and was the way it was manifesting in my life could be, I think I'll just have a glass of whiskey tonight, or I'll have a glass of wine to relax, or whatever. And that would exacerbate I woke up feeling like crap because there's alcohol on my stomach. So then I need to eat something that's going to be really heavy in carbohydrates. So then I'm going to, eat something heavy on my stomach. I need to have a big breakfast because it's the most important meal of the day, and like all that weird stuff that has not a lot of like statistics and science behind it, that like we've just been conditioned with and never had time to experiment with, well, what's actually right for me. Wow, I actually feel much better when I have a cup of hot tea after a long day, and instead of watching TV to do, or even sometimes while my husband is watching TV, I'll run and get my yoga mat, and I'll be in the floor kind of, halfway listening to the TV as I'm doing my stretches. And so yoga practice has been a huge help for me in dealing with my pain. So I've always believed I've suffered from fibromyalgia. I definitely have a family history of osteoarthritis, and so quite a bit of pain that I used to manage with boatloads of ibuprofen, each day. And it wasn't getting any better. And then I kind of became concerned. I couldn't take them when I was pregnant, and I just kind of really began moving away from wanting to take any type of medicine and just any kind of alcohol. And then I really began looking at the foods that I was eating and cutting out sugar and cutting out processed foods and learning how to cook in a different way. And learning how to set aside time for cooking. So my problem, because I have 3 kids and I run 3 businesses, is I don't have time to grocery shop and I don't want to spend time meal planning. Like, even if you gave me a recipe, if I don't have the ingredients in my fridge ready to cook, it's probably not happening. Like, we're calling Domino's. So I'm not like a saint here when it comes to food, but I really try to have healthy options in my fridge. And one way I've done that, because I live in a food desert, you can't get lentils and quinoa and jicama and some of these whole grains and whole plant-based menus that my vegan friends and vegan chefs were sharing. And I signed up for a meal delivery kit called Purple Carrot. And it also taught me how to cook, Korean style vegan dishes, Indian style vegan dishes, a lot of ways and techniques of cooking. It's actually made me a much better cook. And we don't eat out as much anymore. I mean, we still will if the kids have a ball game or, we've got something going on. But when I saw how easy it was to shift to this plant-based diet, I thought, I would definitely want to make this part of our experience in Costa Rica. So since 2017, I've been holding these, weekend long masterminds for female entrepreneurs in healthcare. And we had done one in Nashville. We'd done one in Las Vegas before the pandemic. We did one in Salt Lake City and Scottsdale more recently. And when I was planning out this week-long retreat, I thought, I don't want to make it more about information and memorizing frameworks and, doing conferencey style stuff. It's integrated with workshops that are delivered in a way to help you look inward. So we have our retreats, 5-day and week-long retreats set up for healthcare professionals to be able to come to Costa Rica, to the blue zone. So there's only 5 blue zones in the entire world, and these are areas of the planet where people live the longest. Mostly it's thought to be related to the kind of purity of food they eat and the thoughts they think and and the land they live on. And so Costa Rica is one of those countries that that has a designated blue zone, and our retreat center is right smack in the middle of that blue zone, which is the Guanacaste Peninsula, which is known for its beautiful giant Guanacaste trees that have this amazing umbrella-like canopy. And so we've got a couple, they're actually protected in Costa Rica, so you cannot cut them down. And we've got, I believe, 3 Guanacaste trees on our property at the retreat center. So the retreat center was an old hotel called the Hotel Flying Crocodile. And there's even a little like cartoon crocodile with wings, a little mosaic in the bottom of our pool that, even though we renamed the center Consamania, it's still fun to see this little cartoon crocodile with the flying wings in the pool. And so the space has a beautiful open area lobby and restaurant when you first walk into the space. And then the grounds are manicured like a botanical garden with 10 very unique, each cabin, we call them casitas. Each of the casitas has its own theme and has its own architecture. And so each of the casitas are very unique. And so we always enjoy matching the energy of our attendees to the casita that they've been placed in. And then at the very back of the property, we have this round Maloka type structure with a thatched roof, a 2-story. We have a sky view yoga studio on the 2nd floor with these beautiful teak wood floors that we hold groups. We do ceremonies, we do sound healings. And we host groups for yoga retreats as well as professional development and career development retreats. We host large groups. So startup teams and anyone that needs a space for a team of about 10 to 20 to be able to host on this property. So I've kind of developed my own retreat or my own retreat week there to incorporate this plant-based diet with ideas for how to shift the stress levels. And one of my favorite things to teach in the pharmacy is the box breathing technique. And I teach that to patients. I tell them this is used by Navy SEALs. This is used to, for leaders to calm and shift their nervous system from the sympathetic go, 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 run from the tiger, fight or flight, to shift that vagal tone towards parasympathetic, when you can be more open and calm and relaxed and less reactive to things. So I always say this box breathing technique, it's super simple. Draw a box, 4 breaths in, hold for 4, out for 4, hold for 4, in for 4. And so you can just imagine how simple that technique is. It's not expensive, and it's actually quite free and beneficial. And whether or not you're interested in meditation or yoga or any of those things, that simple breathing technique is powerful enough, if done with focus, to be able to shift your body and your nervous system into that parasympathetic state. And that's the state we need to be in to be less reactive leaders, to be parents that yell less. It gives you like some space in between the thought in our heads and what actually comes out of our mouth to say, oh, is this a good idea to say that? And when we practice that, it gives us that self-awareness of maybe what that person said wasn't actually what they meant, or maybe listening and taking what people say as exactly what they meant, but more of a projection of their own beliefs, not a call on who we are as people. So it kind of helps you to develop that thicker skin that you need in entrepreneurship, because you're always going to have people that that may say, well, Michelle, you have such a great job as a pharmacist. Are you crazy for wanting to leave your job as a pharmacist? Blair, why would you want to stop being a pharmacist? You've got a farm, you've got a retreat center, you've got all these things. What's going on? And just taking that as more of a projection that maybe someone else wishes that they had more courage to do the things and give themselves permission to do the thing that they really want to do. And so I always tell people, it's your life, it's your decision. And when we can become conscious of the choices that we're making and how they are affecting everything that's going on in our lives, that's when we can begin consciously creating that new reality and where we want to be in the future of healthcare.
Oh, absolutely. I mean, I think, being conscious with oneself, creating that space to slow down, just to breathe. Sometimes you just tell someone, just take a breath. They want to like slap you because they think you're being rude. But when you do take that step back, it changes everything. I mean, this Metamorphosis series, as the listeners can hear, listening to all 4 episodes at the same time, we've gone from talking about healthcare reform and innovations all the way to, leadership, self-care, personal development. You can see this trajectory and the metamorphosis from the pharmacist who you are, the cocoon, into this magnificent butterfly that you can create and change your life and change the lives of your patients. Do you want to let the listeners know, like, how they can find out more information about your retreat and what to do next?
Absolutely. So, I just wanted to thank you, Michelle, for having me on this Metamorphosis series. And I think you mentioned earlier something about creativity. And I always say that business is an act of self-expression. And if you don't know who you are and what you want to say, then it is really hard to be creative. And so giving yourself that time and that space in order to cultivate that and to really figure out what is it that you want to say, what is it that you want to express to your patients in a new way is very important. So for people that are interested, we have books and lots of resources and things available for free on our website at pharmapreneuracademy.com. And if you're interested in an upcoming retreat, hosting an upcoming retreat at either our retreat property in Costa Rica or attending one of our retreats as a participant, you can reach out to me on LinkedIn. I'm at Blair Thielemeyer on LinkedIn, and pretty easy to find me on all the socials. So I really appreciate those who have listened to all 4 episodes, and am really excited and optimistic about the future. And I think this metamorphosis is really about innovation and about creativity and about what you want your own personal metamorphosis to look like. So it's been really fun to join you once again, Michelle, on the Conscious Pharmacist Podcast. And thank you so much for this collaboration with also the Healing Medicine Show, which is a show for healthcare professionals to provide resources on personal and professional development ideas that help healthcare professionals begin to think about their skills and their knowledge in new ways through consulting and entrepreneurship. So we'd really appreciate a follow, or you can subscribe to our YouTube channel to get access to all of our upcoming shows.
Great. Thank you so much. Thank you, everybody, for listening. Coming later this year from MesureX Consulting is my Living Well series. It's called High Performance, How Pharmacists Can Prevent Burnout and Be Rock Stars to Your Patients, Team, and Your Family. So that'll be coming later this year. And, we'll see you again soon. Thanks for joining.